Hello everyone, my name is Lichi. I am a diabetes nurse educator. Today I would like to talk about diabetic neuropathy. Diabetic neuropathies are the most prevalent chronic complications of diabetes. It happens when diabetes causes damage to our nerves. It can affect different nerves in our body, including feet, organs, and muscles, and can cause various health problems depending on the types of the nerves affected. There are different types of neuropathies. Today I will be discussing main four types of diabetes neuropathies, which are diabetic peripheral neuropathy, diabetic sensory neuropathy, diabetic motor neuropathy, and diabetic autonomous neuropathy. Diabetic peripheral neuropathies are the most common type of neuropathies and which affect nerves of the feet and hands, which can be either sensory or motor neuropathy. American Diabetes Association consensus report states peripheral neuropathy can occur 20% of type 1 diabetes patients and 50% of type 2 diabetes patients after 10 years of their diagnosis. Also, they reported peripheral neuropathy may present 10 to 15% of newly diagnosed type 2 diabetes patients. That means neuropathy begins to develop at pre-diabetes stage itself. Now we will see what is sensory neuropathy. It is the damage to nerves that tell us how things feel, smell, and look. It affects the nerves that carry messages of touch, temperature, pain, and other sensations from the skin, bones, and muscles to the brain. It mainly affects the nerves in the feet and legs, but the people can also develop this type of neuropathy in arms and hands. So, what are the signs and symptoms of sensory neuropathy? So, it can be tingling or numbness, or inability to feel pain, or inability to feel change in temperature, or loss of coordination, or burning or shooting pain, usually that worsens at night. Loss of feeling is very dangerous because you may not notice minor injuries. For example, if you step on something sharp like a nail while barefoot or get a blister from badly fitting shoes, you might not be aware about that if you have no sensation. If it not, minor injuries may develop into infections or ulcers. That's why it's really important to look after your feet when you have diabetes. Diabetic foot ulcers are the late complications of neuropathy which can affect the quality of life. Consequences may be hospitalization frequently, lower extremity amputations, or death. Lifetime risk of diabetic foot ulcer is 19 to 34%, and there is 65% chance of recurrence in 3 to 5 years. Amputation incidence is reported as 20%, but it increased up to 50% in some regions. Mortality in 5 years is reported as 50 to 70%. These data are really scary, but do you know diabetic foot ulcer is a preventable cause of mortality? Now we can see what is diabetes motor neuropathy. It occurs when diabetes affects the nerves which control the movement. It can cause muscle weakness, eventually muscle wasting due to less activity, and patient may experience muscle cramps or muscle twitching. Diabetes motor neuropathy is the main cause of fall among people due to lack of power and coordination. Next topic is diabetic autonomic neuropathy. Diabetic autonomic neuropathy is a vast area for discussion due to its complexity, which occurs when damage to the nerves that carry information to our organs or glands occurs. Symptoms may vary depending on which organ is affected. For example, if oculomotor nerves of the eyes affected, the patient may have difficulty to open eyelids or may have inability to move eyeballs. Patient can have irregular heartbeat if heart get affected, loss of bladder control or incontinence of urine if urinary tract get affected. Erectile dysfunction is a major complication of diabetes which happens when the nerves to the genital system get affected. Gastroparesis is another major issue where food cannot move through the digestive system effectively. Symptoms include bloating, constipation, or diarrhea. Prevention is the key component of diabetes care management due to lack of treatment that targets the underlying nerve damage. Prevention of diabetic neuropathies focuses mainly on glucose control and lifestyle modifications. American Diabetes Association recommends optimizing glucose control as early as possible to prevent or delay the development of neuropathy in people with type 1 and type 2 diabetes. Optimizing glucose control caused 78% relative risk reduction of peripheral neuropathy in type 1 diabetic patients and 5 to 9% relative risk reduction in type 2 diabetes patients. Glycemic control with lifestyle interventions reduced risk of cardiovascular autonomic neuropathy by 60% in type 2 diabetes patients. Also, impaired glucose tolerance neuropathy study and diabetes prevention program reported lifestyle modification benefits on measure of cardiovascular autonomic neuropathy and peripheral neuropathy. Diabetic neuropathy is not reversible because there is no target treatment to cure underlying nerve damage. Treatment mainly focuses on pain and symptom management, prevention of further complications like food ulcers and charcot food, and these are achieved by daily food inspection and annual food examination with your healthcare professionals. You can avoid diabetic neuropathy by keeping your blood sugar levels within the target range, which will help to protect the blood vessels that supply your nerves. You may need to check your feet every day and have your feet checked by a healthcare professional once in a year. This is particularly important if you think you have lost the feeling in your feet. Thank you for listening to me. We can work together against the diabetes to improve the quality of our life. Thank you.